I'm Julie. I'm going to be your nurse for tonight. I brought your 9 p.m. medications in, but before I give them to you, I just want to do a quick assessment. It shows in your chart that you lost consciousness during the accident, and that can be really scary. So it's not uncommon to have a little anxiety about that, okay? But just to make sure everything's okay, I'm going to rule out any issues. So I'm going to check your pupil response. I'm going to shine my pen light in your eye, but I don't want you to look at it. I want you to kind of look at the corner of the room, kind of where the wall meets the ceiling, while I'm shining this on your eyes, just so I can see what's going on without damaging your vision. Okay, so here we go. That's the first one. Then we're going to do the second one. Great. Okay, so that looks good. Your pupils responded briskly, which is what I want to see. So now I'm going to move my pen light in some different directions, and I just want you to follow it with your eyes, but not your whole head, okay? So we're going to start up here, okay, and then here, and then down here, and then here. And one more thing. Okay, good. So your pulse response looks good. Not too concerned about any head injury or neurological issues. Have you been having any dizziness though? Yeah. Any nausea? Feeling like you're going to throw up? No. Okay, what about any sudden headache or change in any way you feel with your head? Okay. All right. Well, that's good to hear. But if something changes and you suddenly do get a headache or randomly feel the need to vomit, just press the red call light button and let me know, and I'll come in and we can deal with that as it happens. Okay? Great. So I want to listen to your lungs and your heart and your belly, just to make sure everything sounds good. I want your lungs to be clear. I want your heart to be regular, and then I want your belly to have bowel sounds, which is kind of like gurgling. Okay. So here we go. All right, so take a deep breath for me. Okay. Another deep breath. All right. Another one. Another one. Okay, I'm going to listen down the sides here because that's where we would most likely hear some congestion. Okay. And then on the other side. Great. Okay. So I'm just going to listen to your heart. All right. Sounds good. So that's good. So I'm just going to listen to your belly down here. And I'm just listening to all parts of your intestines. I want to start at the bottom, go up and across, and then down again. And I'm hearing some good bowel sounds. So that's good. Your bowels are moving. That's what we want to hear. Your heart sounds good. Lungs are clear. So those are all good things. Just going to check your blood pressure now. So just kind of squeezes your arm a little bit. Put this little cup on. Okay. And then I'm going to pump it up, but I do have to have my stethoscope in place when I do that. Yeah, I got to be able to hear your brachial artery there. Okay. So I'm just going to put this under arm. Yeah, I'm just taking it up to like 180 just to be sure. You don't have a history of high blood pressure, but that's where we like to kind of start things out. Okay. Okay. Getting 120 over 80. That's perfectly normal. So that's what I want to hear. Oh gosh, I'm seeing on your arm there that the tape on your IV is kind of coming loose. Yeah, and you've only got the one IV, so I kind of want to take that tape off and put some new tape on there to kind of secure it. All right, so let's try and get this tape off here. Yeah, it's a little sticky. Yeah, got a lot of pieces there. Okay, so there's that one. Now we got one more over here that's kind of Yeah, they're my bandage scissors, so they're kind of dull, but enough to cut bandages and tape off. Yeah. A lot of tape on here. Have they reinforced this before? Yeah, Packy likes to do that. Okay, all right, so let me get my tape here. Keep it on my stethoscope to keep my stethoscope from sliding off my neck all the time. All right, so let's get you a couple new pieces of tape here. Okay. Okay, get that in place. Okay, and tape that one on. All right, so let me just take an alcohol wipe. These little things here, I'm gonna wipe the tip of your IV and flush it with some saline to make sure it's still working okay since the dressing was so loose. Okay. This nifty thing. Put this on here. Good. Alright, get a little flush out of my pocket. Yeah, they come in little baggy things. Okay. Alright, so now your IV is all nice and secure. The next thing I have to do is do pin care on you. You had an X-Fix put on. Yeah, it's those long metal rods on the outside of your leg. It's called an external fixator. It helps hold the bone in place so it can heal correctly. Yeah, so you see the little pins? There's like 4 of them down at the ends of those metal rods. Yeah, so we like to clean those at least every 8 hours just to make sure they don't get all crusty and infected and stuff like that. It's not too terribly painful, but just in case I did bring your pain meds, you have Norco, and that's hydrocodone. So, brought you 2. How would you rate your pain right now? Yeah. Does it get worse when you move? Yeah. Does anything make the pain go away, make it feel better, besides medication? Okay, well, we can definitely try elevating it here in just a second, okay? So let's go ahead and take these, just the 2 Norcos. Okay, great. All right, those may take about 30 to 45 minutes to kind of take effect, but I want to go ahead and get your pin care done. If the pain medicines aren't kicked in by about 30 minutes, then I can always come back and give you the IV pushed allotted. They don't like us to give it to you immediately. They like it to be for breakthrough pain, which, like I said, if the Norcos aren't covering your pain and you're still at a 6 or a 7, just let me know and I can bring you that's allotted. It goes right into your IV. Okay, so for pin care, I'm going to use the hydrogen peroxide. Just sanitizes the pins, like the skin around it, without damaging the skin, so it's not a harsh chemical cleaner. I don't have to shake it up, but let me go ahead and get this plastic off of here. Open that up. I use a new bottle for every patient because it wouldn't be sanitary to take it from patient to patient. So I'm going to pour that into this little cup. All right. Just need a little bit to dip my pins in here. Okay. All right, so that should be enough. Don't really need the whole bottle, that's just what they come in. So now I'm going to take my Q-tips. I usually use longer ones, but this is all we have right now. And I'm going to dip it in the hydrogen peroxide. I'm going to go down here. I'm just going to wipe it around the pin. Like I said, not too terribly painful, but sometimes it can irritate people. So I usually use 1 Q-tip per pin. So I'm going to dip it in here again and clean this other one. Okay. And then a third one. one. We're going to clean up here at the top. Okay. And last one. Okay. This one's got a little bit of stuff around it, but it's not too red, it's not hot, so not too concerned about having an infection, but I'll keep an eye on it just in case. Okay. All right, well, do you need anything else while I'm in here? Yeah, you probably are really hungry since you haven't eaten all night and you had surgery this morning. What would you like to eat? Our pantry has Jell-O, pudding, orange sherbet, ice cream, applesauce. Jell-O? Jell-O's a good choice because it probably won't make you nauseous. So I'll go and get some of that, bring it back to you, and reassess your pain level. I kind of want your pain level to be below 4. And like I said, if it's not, I can come back and give you an IV push at the lot. Okay? All right, well, if you need anything else before then, just press the call light and let me know. Okay?